Okay, so we will get started, and anyone else that wants to join us will certainly just jump on in. But welcome everyone to our spring panel discussion. Special thank you to our panelists. I will kick it over to Dr. Baker, who will introduce himself, and then our panelists, and we'll get the ball rolling.
Sounds good. Thank you, Morgan, and thanks everyone for joining us. Really appreciate you taking time out of your day to spend some time. So this is our spring alumni panel. Let me first introduce myself. So I'm David Baker. I'm an adjunct associate professor with the program. I'm also co-director of the Masters in Applied Science and Population Health Management. I teach a course every year on ways to design and assess the effectiveness of population health, community health, and health equity work. Um, and I'm also employed full time as executive director of population and community health at LifeBridge Health, which is a large 4 hospital health system in Maryland that really spans the care continuum from inpatient to outpatient care. So I'm really pleased today, and in terms of the format of our time today, we have 2 alumni of the program. And so Deborah Thompson and also Martin van Aken joining us from the Netherlands. Really thought it would be good to just have first start off with having them introduce themselves. We'll go through some questions. They can tell us a little bit about kind of their experience with the programs and how they've used it in their careers afterwards. Um, then we'll just open it up for you guys to ask questions, make comments, and just kind of go from there. Any questions before we get going? All right, well, let's get started. So let's first, why don't we have Deborah introduce yourself, tell a little bit about where you work right now, your career, um, and then we'll go to Martin for the same thing.
Certainly. Hello, everyone. My name is Deborah Thompson. I am a 2019 graduate of the Population Health Management Program. So I was in the very first cohort. I live in Whitakers, North Carolina, which is very rural community in the eastern part of the state. I work in Greenville, North Carolina, which is an hour away east of Whitakers, and I'm the president of Access East, which is a care management entity, and we are an affiliate of the health system here in Greenville, which is ECU Health. I've been in healthcare for 41 years. Started as a nurse. I have, over my career, spanned inpatient arena. So I've worked in hospitals at very small community hospital, very rural setting, up to an acute medical center, a tertiary medical center. I've also had experience in the community setting, working with businesses, industries, care managing people with chronic disease and social health needs. And I've also overseen wellness centers and helped to connect people on the wellness aspect of keeping them healthy. And since 2013, a lot of my focus has been on the efforts of ambulatory quality and care management and care coordination. And we began with our ACO back in 2015 and have evolved since then.
And you'll probably get to this, Deborah, but Deborah's also has joined our faculty and teaches in the program. Now let me turn it over to Martin to tell us a little bit about himself and his career.
Sure, thank you, David, and thank you for the invitation to be here. My name is Maarten van Aken. I'm an internist endocrinologist working in the Netherlands, in The Hague. In my mid-career, beginning of 50s now. And our city is it's the fourth city of the Netherlands, about 700,000 people living here. And the hospital I work in is located in the southwestern part of our city, where there are much more disadvantaged people living compared to in other regions here. And one day a week, I also work at the Leiden University Medical Center. It's a university center here nearby The Hague. And there I'm especially focusing on the role of the hospital in the population health management area, which is quite still in its infancy here in our system. So first in the hospital, I was responsible for teaching the internal medicine residents for a couple of years. And then about a couple of years ago, I was introduced to the population health management field here in Leiden. And then I also decided to follow the master's at Johns Hopkins and graduated in last May in 2022. So a couple of years after Deborah. And well, now I'm applying these concepts, which we'll probably talk about later in practice.
Excellent. Thanks so much. And maybe just to start, why did you start exploring graduate programs at this point in your careers? And start with maybe Martin on this one, and then go to Deborah.
Well, as I said, I'm a person who's looking for new challenges every now and then, every couple of years. So after having done the training of the residents, I thought it's time for something new. And obviously, well, in our region also there are quite a lot of health disparities, which I noticed, of course, in my daily practice, treating patients with diabetes and seeing very disparate outcomes there. And also, I noticed that the way we currently have organized healthcare is not really dealing with those differences at all. Especially from the hospital side, it was very much treating patients who are referred to us and sending them back to primary care and not really seeing what's happening afterwards. So it's a very siloed way of organized healthcare. Of course, in the Netherlands, we have a very strong primary care, which is a good thing, I think, but still it's very siloed with secondary care. So that led me to look for, well, new things, new perspectives. Population health management came around, some summer school talks I followed here in the Netherlands, and then started looking for more wider program, and then found the master's program at Johns Hopkins was really, I was really thrilled about, because it covers such a broad spectrum of topics that really give you a lot of tools that are really applicable in daily practice. So yeah, that made me choose the program. It was a very good fit with the working in daily practice and doing the master's in part-time online. So that was for me, it was a superb fit.
Excellent. Thank you for that. And Deborah, I'd ask you sort of the same question, sort of why you chose population health management at this point in your career, why a graduate program?
So that's a great question. After I completed my doctorate in nursing, I had considered my education career was complete. I had not planned to go back to school, but things did change, and I'm very fortunate and glad that they did. Through my care management duties, I became really intrigued with how to engage populations and how to do so in a way that really improved their health status and overall outcomes, and trying to figure out, which interventions work best and how can you make that greatest impact. And where I live, it being very rural, there's a heavy burden of chronic disease as well as social care needs. And we all know that the impact they have on health status. But I began to identify that I had gaps in my education where that really related to population specific, how to go from where we currently were and move forward, especially in a world where we're looking at value-based care and new models of care coming forward. But there was a gap there for me. And so when I began looking forward, just some continuing education programs, and did not find what I was looking for, and ran across the population health management program at Johns Hopkins. And when I looked at the course content, I knew right then this was the program that really grabbed my attention. I felt like it had what I needed to be able to make an impact, not only in my community, but also in my health system. And and I knew the reputation of Johns Hopkins and the faculty there. And so I immediately began looking into how can I make this happen and work at the same time, because I had to keep working. So for me, once I saw that content, I had to go for it. So.
That's great. And did either of you look at other programs as well? Did you come across other programs in population health management? And if so, what led you to choose the Hopkins program? Maybe Deborah, again, you can start.
So I looked at other programs, and there were some well-known universities that also had population programs, but the content and the foundational elements that I saw in the program at Johns Hopkins, to me, it was very solid, and it gave me the tools that I needed in order to be successful. So I was looking at the content itself, but also, where I needed to be in order to make a difference. And when I compared all the curriculum, Johns Hopkins had the full package of what I was looking for.
Great. How about you, Martin?
Yeah, I completely agree with Deborah. I have the same experience here. Of course, for me, coming from the Netherlands, is a bit more difficult to compare programs back in the US. But however, of course, the reputation of Johns Hopkins, well, that's very, very obvious. And I fully agree that the completeness and how the different subjects they connect to each other are really very well designed. And another factor for me, which attracted me, was that the masters is being followed by, of course, people from lots of different disciplines, different backgrounds, and to being able to interact with the co-students from different backgrounds, different disciplines, is really an extra bonus I've experienced.
Yeah. Great. And so having gone through the program, what would you tell people who are considering applying based on your experiences, and maybe also based on what you sort of originally expected versus kind of what you found to be the case after completing the program? And maybe Deborah, why don't you start?
So, if you want a really solid foundation in population health management, I think this is the program for you, because that's certainly what I experienced. You have to apply yourself, you've got to put the time into the program. But if you want to be an expert in population health management, but I've taken several online programs. My doctorate program was online, as well as my master's, and this was my third program. But from a platform standpoint, from an ease of use of the Course Plus, to how the flow of the program, this was the best to me. And so it prepared me not only for the work I'm in today and where I'm headed, but also the assignments helped prepare me for that capstone, which is the ultimate at the end. And it really helped me to pull from each of the classes that I took. Each one was very important and all contributed to what I needed in order to be fulfilled in this program and graduate on time.
And Martin, what would you say?
Yeah, lots of comments of Deborah resonate with me. It's very well organized. You put you in a pace which is really well helped me a lot, because you have steady on, you have in between some tests to perform, which are doable, but they keep you on track. You keep really engaged. The talks are really very, very high level. Well, to illustrate, I'm still sometimes taking my notes from these talks and look them up. So, well, I don't have lots of other classes I followed in the past I do that for. So that tells a lot, I think. And it's really also very applicable knowledge you are provided with. So it's not all theory, but it's really aimed to use in clinical practice, and I'm currently doing that. So I found it a really very useful training program, and a very joyful experience in all, very much.
Excellent. And I just mentioned, I think Deborah mentioned the capstone program or the capstone course, which happens at the end of the program. And that's an opportunity for each student to really pull, you're basically given a case and an assignment to kind of pull together a population community health strategy for improvement of that situation. And gives students an opportunity to pull on their different learnings from these different courses and really apply it to how they would really address that issue. Meant to be very sort of practical and things that students can then take with them into their current careers. Um, and and maybe getting a bit more specific in terms of what skills or tools do you feel that you've gained from the population health management program? And maybe Deborah, let's start with you again.
Sure. So, when I started the program, I was leading some work in care coordination, but more on a small scale. What I was able to gain was the ability to lead our care management company for our health system. So I went from managing about 10,000, I call them members, people with health problems, to we have now well over 150,000 covered lives that are part of our contract that my team are responsible for. And this is in a very rural area. So not only with the challenges of what people have to face every day, we are now held accountable for meeting certain deliverables. And so this population health management program prepared me to be able to lead that work. I also am part of a senior population health leadership team that we look at evaluating all 29 counties, which is our service area, and implementing programs to ensure that we help move healthcare and people in the right direction toward improved health. I negotiate contracts with practices for our services. So the services that Access East provides has almost doubled. And, it's now the services that we provide, but also the covered lives as well. And we just recently, about 2 years ago, obtained a multi-million-dollar contract with the state to test social interventions on overall health outcomes. And we're one of 3 leaders or network leads in North Carolina testing that project. And I think without the preparation and the skills that I learned during my time in this program, I wouldn't have been prepared for what was headed our way. And we're doing very well in all fronts of that. Also, as you heard Dr. Baker say, is also giving me the opportunity to give back as being a faculty in one of the courses for the program. And so it's many skills, many that I in my mind is not thinking about right now, but it definitely has led to my career growth and also improvement in our part of the state.
Excellent. Thank you. And Martin, how about you in terms of skills in your career?
Yeah, I certainly have obtained the tools that I really can apply in my daily practice. We're so, as I said, I'm an endocrinologist, so treating a lot of patients with diabetes, and now we are setting up and bringing into practice a new way of diabetes care, where we apply actually the Johns Hopkins developed algorithm, the HCGs, to re-stratify the diabetic population, not only on medical but also on social determinants of health. So that really is bringing a lot of new perspectives on this population, and also opening up the eyes of a lot of colleagues who are really now getting inspired by this new perspective also. So as I said, it brings the courses bring all the different components that you need for such a movement, starting from just designing this new population stratification and bringing it forward to new ways of accountable care, bringing in the health behavior on the table, alternative payment model to make it work, and also the more the governance side, the collective impact mode is also all these are all topics that are being addressed in the courses, and so that makes it so complete. I think that all the different tools you need in your toolbox to really get things work in practice, they are there, and you will get all the knowledge and really high level insights that you need for that. So and at the end of the masters, the last semester indeed is quite a challenging thing to do. I think it was, and you feel kind of on your own, being an advisory group, when you have to assess community health needs assessment and draw a plan for that. So, but so you are challenged, but I think in a good way, a good positive way, and it's a doable way also of combining the studies with really clinical practice as well. Yeah.
Great. And I would just, sort of end this question and answer part by just asking the two of you if you have any other things you'd like to add or share at this point. That'd be great. If not, we can go to kind of Q&A from the participants.
I'll just add that the relationships that you build within a curriculum like this and with your classmates, because people from all over the world, come to Johns Hopkins for a reason. And I know in the class that I was in, we're from across the globe. You learn from each other, and you develop those relationships that you take throughout, a lifetime. And so it's very meaningful on multiple different levels. And I agree with Martin. This program really prepares you to be able to be a leader, a voice at the table, to advocate for populations. And regardless of your background, whether you're in healthcare or other disciplines, being able to have that voice and to speak and advocate and move forward in the programs, because this is where healthcare is going. With value-based care and population focused, Johns Hopkins prepares you for that. So for me, it was a blessing.
Yeah, Deborah, I completely share your thoughts. And maybe for those who are a bit anxious about some subjects are a bit more basic subject like epidemiology and medical statistics. So, but in my experience, these topics are also given at a very good level, built up very consciously, and taking into account the different starting level of people in the course. And the faculty is really taking care of that very sensible way. And in my experience, also those subjects are really very informational. And I mean, I have been following those subjects before, but for me, it was really giving a more deepening insight as well. So I think also those subjects are really adding to the program, and not an possible barrier or something like that. Not at all.
Great. And so I would just add, I mean, as someone who's been with the program since, I guess, about 2015, as it developed, it's a lot of the faculty, first off, are working full time in this field. So we have people like myself, Deborah, and others who have full-time jobs in population health and community health management. So we really bring to this very practical knowledge of kind of what's required, and weave that into our curriculums. I also want to note too, I think, Deborah and Martin referenced the group work. That's a big part of these courses. So we really we understand that there's an opportunity to learn from a really varied and multi-professional student body. So we'll pair you up usually in groups of maybe 2, 3, or 4 to work on certain projects throughout the courses. And this gives you an opportunity to kind of work with others, kind of learn, sort of their strengths and how you can kind of meld your mutual strengths together to produce a useful product. And that's something that we've heard a lot of feedback from our students that this is kind of really a benefit to their learning throughout the course. And also I'd say as this course has evolved, I think the faculty has done a lot of work to make sure that it stays current with current needs throughout the country and throughout the health system. And I think we've taken a lot of feedback from our students and really tried to incorporate that into our program. So we're really meeting your needs as best as possible and making this as applicable as we can. So with that, and I don't know, Morgan, did you want to add anything at this point, or should we just go to kind of Q&A from the group?
Yeah, let's jump to the Q&A for the group. See
Okay,
if anyone
great.
has any questions first.
Yeah, so please feel free to raise your hand or just unmute yourself if you have a question for our panel.
Hey everyone, I had a question for you guys. And first of all, thank you, Deborah, Martin, and yourself, David, for giving such good color on this program. One of the questions I had for the panel was I currently work within strategy and planning for a health system. And this health system is in Virginia. So what Deborah said about a rural market resonates with some of the work I do, where we have to see, whether we should keep an OB unit open because it's a community hospital. We can't simply just shut it because that would adversely affect the population. My question for both Martin and Deborah is, Deborah, you were a nurse, Martin, you're an endocrinologist right now. How important was the clinical background for you guys? Did it help? Did it hinder?
And maybe Deborah, do you want to take that first?
I'll take that first because I figure out where my mute button is. Then that's a great question. I will tell you that population health management is a team sport. And it takes all disciplines at the table to make an impact. And when you said you were from strategy and planning, the first thing that came to my mind is how important our planning representative. He's not a senior officer, but his background is planning, and he is the first person we go to start talking about data and community hotspots and that type of thing. So I'm glad that you're on the call and you're asking about this program. But for me, I mean, the clinical aspect, it helped me in the care management component, but sometimes it can also have some blinders if you don't open and become aware of how all parts of I'll say that the human aspect of the needs, when you think about population management, it's not just a clinical person. You need data. You need someone who is on the front line. You need all levels and all backgrounds to come together to get a really thorough program. And sometimes the more you know, the more you maybe miss some very important areas that you need to focus on. So sometimes we have to step away from the table because we maybe had some blinders on. So having that varied background, I think is critical. For me, I was already started down one avenue with population management, and it really helped to open my doors to how important all aspects of team members are to when you start talking about how to develop plans and implementation strategies, especially with these new care models that are coming out. And the patient has to be the center of all of that.
Yeah, that makes sense. I mean, in my role in strategy and planning, it feels very macro sometimes. And it's always good to know, I actually want to delve into the rural population, what their needs might be, and, maybe like use predictive analytics from our end to see what, it looks like, what the, picture looks like for them maybe 5 years from now. So thank you.
Very important.
Anything to add to that, Martin, or I think you've kind of
Well,
spoken.
I can completely agree with Deborah that I mean, having a clinical background is definitely, in my view, not necessary to be able to follow the program and to to take in the program. The multidisciplinary team approach is also resonated in the master student population. So that makes really the energy there. And well, as a clinician, I think it makes you modest this course, because I mean, being aware that clinical care is only contributing about 15% to the health outcomes. So all the other factors are so much more important. And it really in the courses, it's not at all necessary to have the clinical background. No, I would say for sure.
Yeah, and
I agree with Mark.
Yeah, and I would just add to that. So I also serve on the admissions committee for the program, and we certainly admit folks who don't have clinical backgrounds. We admit administrative folks, people really from all aspects of healthcare. And as both Deborah and Martin have said, they really contribute to the overall kind of understanding and learning. So that's been really important to us. And certainly strategy is one of the aspects taught throughout the course, and not just in one particular course, but we understand that it's very important to have a good sort of, or several frameworks in mind about how you would approach kind of thinking about, okay, here's a problem that we're having to address. How do we even think about that in this very sort of complex healthcare environment? And who do we need to kind of involve? How do we track this going forward? What data do we need to be looking at across the spectrum? So it's definitely in the wheelhouse of somebody working in sort of strategy and planning. Other questions?
Hi. I can't find a hand, so I'm just gonna speak if that's okay.
Sure.
So I actually have a similar question. So my background is not in healthcare, although I've worked in healthcare all my life. I guess I shouldn't say that. My nutrition is my background, and I think I guess my concern was, are there courses where additional help is provided, where there is a lot of significant focus on healthcare related activities? Like I'm more thinking about if there are courses that are science based or specifically care based that we would need to be aware of. Just because if you have a background in it, it might be much easier. If you don't have the background, if you haven't lived through it all your life, I think it might be a lot more difficult. So.
Yeah, and are you talking about courses such as sort of epidemiology, biostatistics, that type of thing?
Yeah.
Yeah, and so Deborah or Martin can speak to that. I think they may have had some biostatistics, and I'm sure they had maybe prior to entering the program, but and for my graduate work too, it had been a while before I had stats, since I had stats, but I think it's helpful. I think, as Martin noted too, it's provided in a way that's accessible, so you don't have to have been a biostatistician or a clinician really to get benefit from that and to really kind of gain from that. And again, in sort of an applied fashion, so you can apply it to the work. But don't let me speak for you guys. So feel free to add if there's additional thoughts you have.
I agree. It has been a very long time since I had taken any stats course. And I made it just fine. But we also we pulled together as a group, just to give you an example of how relationships and coming together is important. We had little study groups too that we would get together, every week, for whoever that could, and just go through the materials just to help each other. And I think that helped build the camaraderie within our group. But we got, we did well in it, but it's working together, and the material is presented in a fashion where if you had not had any or very little exposure before, they work you through the program and the course. And there's also office hours that are available. So keep that in mind as well. If you need additional assistance or have questions that you need to dig a little bit deeper into our course, all the faculty that I engaged with my time there as a student, as well as now coming back as faculty, are so good to work with and really want you to be successful. I mean, they want you to do well, and so that means it's a partnership, as you're going through this program.
Sorry, can I just clarify? Is this a in-person program only, or is it also available online? It is. Okay.
It's all online.
And possibility to break it down for, I guess, part-time workload as well, right?
Yes.
Yeah. Okay.
Yeah.
Thank you. What is the time commitment, would you say, that you've had to provide? Just because I do have a full-time job and just want to make sure I'm able to learn, but then also, commit to the time that I need to.
So I'll start and I'll say, as a sort of a foundation, we tend to say like 3 hours per credit of class.
Oh,
Typically a class is 3 credits. So that's about 9 hours a week. It can vary. And I'd really ask for Deborah and Martin to kind of state from their experience as students about how much they spend per week on work, reading, study groups, that type of thing.
I would say that's about right. I also, I work full time, and because I'm in a leadership role, I don't work 8 hours. It's usually 9 hours, 10 hours a day, and I drive 2 hours a day, so I drive an hour to and from work. And so, before I started the program, I had worked through on my calendar how I was going to be able to do this, and so I utilized my travel time through listening to courses. But it's doable, but you do have to commit that you're going to, if you're going to take this program, then you're in it to graduate at the end. So utilizing a schedule and blocking time that you commit to the program is important, but it is doable. I think almost everyone in my cohort had a full-time job.
Yeah, I couldn't fully agree. Of course, you have to be committed, and you can, of course, plan your time flexible in periods that you want. I bike to my work, so half an hour go and back. So I also use that time to listen to the, and then re-listen them at home. This song from Johns Hopkins really still resonates in my head, the starting song. But no, it's very doable, I think. And of course, at these hours, you can take a little bit off. If you read all the papers, then of course you will need those hours. If you sometimes have a little bit less time due to work, it's manageable without reading all the details to the last dot. Of course, so that's a little bit of your own choice, and some topics, of course, are more you're more related to than the others. So you can make some choices there, I think. But and you can to make a choice if you want to do 2 subjects at the same time during a semester, or one at a time. So that's optional also to reduce the workload. And I'm not sure, David, how in practice people make these choices. I did 2 subjects every time together, and it was manageable also with a full-time job in the clinic. So with being on call, etc. So yeah.
Yep. Yeah, no, first of all, most of our students are full-time, working full-time in jobs. And most of them, to your point, Martin, do take the 2 courses per term. Some do, maybe switch to 1 term, but most people do it successfully 2 courses per term. What other questions do you guys have?
Yeah, I'll also come off mute. Ken Papineau, where I serve as a director here at the Chicago Public Schools, and my duties are related to coordinating and overseeing healthcare delivery in the school setting. I saw that the master's program is certified by CAMI. And I know that CAMI doesn't necessarily certify the certificate program, but I'm curious if you can talk about your relationship with CAMI and how that relationship might benefit both the MAS and the certificate program, especially from a like the business of healthcare perspective.
Yeah, and well, first of all, I know we're one of the, I think probably the first CAMI certified programs. Um, um, I'm not sure I know the answer though to your question, and I don't know, Morgan, if you know any, more about sort of the relationship with CAMI. I think Mark has been a bit more involved in that aspect. Any thoughts on that?
David, this is Mark. Can you hear me?
Oh, hey, Mark.
Hey, I've been listening. So, David, thank you so much for hosting this. And Martin and Deborah, thanks for joining. If you don't mind, I could maybe offer an answer to the question.
Please do. Yeah.
Um, so, yeah, it's a great question. We were one of the first programs to be certified. I actually sit on the accreditation committee that's developed the standards for population health management programs. And so the CAMI does not get to the level of the certificates, but they do at the master's level. And what they're really focused on is assuring that, and again, I help write the standards, that the competencies that we think are important for population health management professionals to have are being, incorporated into the curricula. And so we've done that well. And for the certificate, we designed the program really for those who are thinking about maybe a master's, but maybe just need some, a primer in what is population health management. So that if you complete the first year of the curriculum, which is, the 2 courses in the 4 terms, so 8 courses, you would earn a certificate. If you decide to continue on for the master's, of course, you can complete the 2nd year of the curriculum. And that's really where CAMI is focused, is not only looking at the first year, which a lot of that is foundational, again, making sure, it was a great question earlier about, do you need to be a clinician? We designed the curriculum to really provide a foundational level of coursework in the first year of the curriculum so that everybody gets on the same playing field. And then we start to dig in to more detailed level courses in the 2nd year. And that's, again, CAMI looks at it holistically. And what we do in the first year is make sure you have the basics of epi, biostats, understand, advanced payment models. We have a course in, essentials of population health. So what is population health management? And so, again, I think it provides a good foundation for people to then move on into their 2nd year. So I'm not sure if I exactly answered your question. Feel free to ask again if I haven't.
That's, for me, that's really helpful. My previous work is a combination of public health and ed psych, and so your explanation helps me kind of differentiate between the certificate program, if you've already have a master's in a related field, and how the MAS actually provides that more, it sounds like more detailed, more extensive training. So thank you for that.
Yeah, and for folks on the call, that's Mark Biddle who just spoke. He's the founding director of the program, and so obviously very involved in its creation and evolution. What other questions do folks have? Anything about time commitments, sort of coursework?
Do you guys ever meet in person? I know it's completely online, but
So we have, so I should back up a little bit and say that, the bulk of the work really is done asynchronously and online. So, as I think Martin and Deborah said, they listen to a lot of the lectures. during their commute. However, we do also have a synchronous opportunity through what we call live talks. And we usually have, 2 or 3 per course per term. And this is an opportunity for folks to get together. Oftentimes we invite a guest speaker to speak on a topic of particular relevance. And that's a time for people to really get together. It's virtual, but it's an opportunity for people to get together, talk, ask questions, share ideas. And so there's that. I would say that, certainly there's graduation when people finish the program, and that's an opportunity. We have receptions, we have graduation itself. So people, just within this program, for that year can get together, meet up in person. But yeah, by and large, I think those are kind of the ways that people get together. I think sometimes too, we've had, I know we've frequently had, multiple folks, students from, a given city. So Baltimore, for example, who will meet up on their own to kind of work together, share work ideas, etc. But that's basically how it works. Does that sort of answer kind of what your question is?
Yeah, it does. And just a quick follow-up to that. How does the capstone work then?
Yep. So the capstone is on your own, and everyone gets it's sort of the last course in the program. I'll let Deborah and Martin kind of add their 2 cents to this, but basically this is the opportunity for you. You're given a case, a very specific case taken from real life, and you're given sort of background information, and you're given several questions, and you basically have to kind of go through all that information, sift through it, and then respond to it. And a lot of the questions are along the lines of, how would you put together a strategy? What elements would you use to kind of address these problems? And how would you measure that? What are the sort of tools and things that you would apply? What would a mock, framework be to kind of get at these kind of questions? And you would basically put it together in I can't remember how many pages, I think in multiple pages, to kind of describe your strategy, and also provide some tools and appendices that kind of outline your idea of kind of what could work. So I'll let Deborah and Martin kind of speak from their experience to sort of how that works. And Deborah, do you want to go first, maybe?
Yeah, I'll be glad to. So that's like your final step there, and I personally enjoyed it because it gave me the opportunity to really, I'm going to say, test myself. That I learned what I wanted to learn along the course of this 2-year program, and so it gave me the opportunity to pull from every course that I took, which was great. So it told me that yes, I definitely have the foundation that I needed. I made the right decision. This is the right program that I've gone through, and it really, even after graduation, the elements that went into that capstone I still utilize today as I'm developing a program that we're going into a new phase of work or implementing for a new care population. That in the principles of what you utilize to pull that information and synthesize to make it into a plan, I still use today. But I think you have 5 weeks to pull this together, and it is an exercise, and I enjoyed it. Whether that makes sense or not, I did.
Yeah, sure. Yeah, I've completely the same experience. Also challenging, especially for me being from a different countries and system, and you were provided with a whole lot of details on Harford County. So when I was at graduation, we actually took a car and drove down there just to see how it was in real life. But yeah, it was a joyful experience, a really integrative activity where you really use all the different steps you've been learning throughout the previous 2 years. You really can apply them step by step in a real life case. And doing some kind of consultancy job, yeah, in practice. So it was really, yeah, it was fun. It was challenging but doable as well, and you get good feedback on it. So it's really very, yeah, learning full experience as well. Yeah.
Yeah, I think that's very well put. And just to add to that too, there is faculty support throughout that process. So in terms of guidance about how to think about this, and answering any questions that students have along the way. Great. Other questions? I think we have just a few minutes left, so maybe one more question. So going once. So I don't see any. So unless there are any final questions, why don't we do this? Why don't we just close the session today? I just want to thank our participants, Martin and Deborah. It's been invaluable, the feedback that you've shared, and really appreciate you taking the time out of your schedules to join us today and help answer some of these questions and provide your experiences. That's been really helpful to us. So, and thanks folks who joined us today and for asking your questions. We appreciate that. So I will leave it there. I don't know if there are any other sort of final words. Morgan, if you had anything to kind of close this out. I think we're always there. If folks do have questions, they can feel free to email us.
Yeah, absolutely. Thank you so much, Dr. Baker. Thanks, Dr. Biddle, for also joining the call. Thank you to our attendees. Thank you for everyone who's joined the session. We really appreciate it. We are accepting applications for the program. The due date to submit your application is July 1st of this year. I will say, please don't wait till the July 1st to submit your application or start it. It always takes a little bit more time than you think. So the sooner the better. Anyone looking to apply to the MAS program that was on this call would be entitled to an application fee waiver if they're looking to submit their application the next couple of weeks. If you have any questions, like Dr. Baker said, please feel free to give us an email. We are always available to answer any questions. So again, thank you everyone for the call and have a great rest of your day.
Thank you.
Thank you very much.